This podcast is recorded and produced on the lands of the Turrbal people. We'd like to acknowledge the traditional custodians of the land and pay respects to their elders, both past and present. Thanks again for joining us on Fertile Ground, a podcast with Dr. Jyotika Ruba, where she answers common questions about fertility and the IVF process. Today we're going to talk about the big questions around egg freezing. How to know if you should, what's the right age to do it, and what is the process of egg freezing actually like? Dr. Jyoti has a special interest in egg freezing and has been an expert speaker on this topic on fertility panels, so we're really lucky to have her here to share her knowledge. Thanks so much for joining us again, Dr. Jyoti. So, egg freezing, how would you know if you need to do it?
That is an excellent question. Since 2016, Janaea has seen a tripling in the number of women presenting for egg freezing. So women these days are incredibly busy. Most women are now university educated. They are professionals and they may not necessarily be in a stable relationship where they feel comfortable having a baby at the stage that they're in. So I think the biggest factor in women deciding on freezing their eggs tends to be the women who are aged between 35 and 40 in Australia, who are professionals, who have the means to think about financially funding their own egg freezing.
And so what's the difference between freezing your eggs versus freezing one or many embryos? Is one a better option than the other?
So in terms of freezing eggs, most women choose to freeze their eggs instead of freezing an embryo because they don't have a partner currently. They do wish to have a child in the future, but unfortunately they are unable to create embryos at the time. So if we're looking at freezing eggs versus freezing embryos, it really does depend on where in the journey a woman is. Up until recently, we've definitely been of the mind that freezing embryos is a better option than freezing eggs. But recent data coming out of the USA does support the fact that frozen eggs actually lead to as good a result in terms of pregnancies and live births, comparatively speaking, to fresh eggs. You know, it's now been about 10 years since the decision was made to move from thinking that freezing eggs was experimental now to using it as an accepted procedure for women to preserve their fertility for the future. There are good reasons and scientific backing to know that this is a safe option for women.
So if you were to give advice to women aged between 20 and 30, what would it be in regards to egg freezing?
I would say absolutely do it.
Why is that?
Because as a professional woman now, and even in a world where gender bias seems a little less than it was when I started medicine 30 years ago, the push, particularly in high-pressure professions like mine, is to keep going through your training, keep going through your specialty training. Don't stop and have a child. That will impair your progress. You will never get through your training. You'll suddenly stop. So as women, we have a lot of pressures to perform, and we're often part of a dual income household. And sometimes when you get on the treadmill, it's very difficult to get off the treadmill of life. So I feel that I would always encourage, if it was financially possible, for egg freezing to take place for any young woman, if that's what they chose to do, because there are so many options now in life, and this needs to be a more affordable option for younger women to choose.
So for our listeners who don't know much about egg freezing, how does the process work? Can you tell us about the medication and how invasive the surgery is?
So usually it's roughly about a two-week process that follows the onset of a woman's period. And it does involve, unfortunately, injections of a hormone that help to grow the follicles in the eggs. And we do a couple of blood tests, maybe a couple of ultrasounds, and watch the growth of those follicles over time. Once the follicles reach a certain size, then we're ready to harvest the eggs or do the egg pickup, which is done under an anaesthetic, so the woman doesn't feel any pain and can't remember the procedure. And at the end of the procedure, when they wake up, we're happy to tell them how many eggs have been collected. It's pretty reasonable recovery, I would say, after an egg collection. So most women are well enough to go to work the next day, but probably need to recover a little bit from the anaesthetic. And then our scientists will usually call them the next day just to confirm how many eggs have been frozen for them.
So it's generally a 2-week lead up plus surgery. How do women prepare for that?
So I think most of the information for elective egg freezing happens before the egg freezing occurs. And before the administration of any medications, they have a nursing appointment where they're able to learn how to use the medication, the frequency at which they'd use the medication. But certainly they continue to have my support and the support of the nurses at Genea through that journey and after the journey also.
But does the medication cause side effects? Can people feel unwell or maybe particularly emotional during the preparation for egg freezing?
I must say the way women cope with the symptoms of IVF treatment is very different. It's very individual. Most of the ladies I deal with don't really get much in the way of symptoms apart from perhaps the feeling of heaviness, the same sort of feeling that all of us women are used to just before a period. And most ladies the next day have little next to no pain, but everyone is different. So I think some ladies may feel that they feel more emotional, some may feel absolutely no different, and preparing someone for a journey, it's easy to say, let's prepare you for a very emotional journey, which may result in the collection of many eggs or perhaps no eggs at all. I think that's a difficult thing to prepare anyone for, and it's essentially up to the individual and not to me how they interpret, how they feel, whether or not they feel like they're getting side effects from the medication, whether or not their recovery has been easy or difficult. That is a very individual experience that's difficult to describe.
So what can women do to boost their chances of having the most amount of eggs?
So to boost your chances, do it younger, because we are never going to have more eggs than you have at any given age. Your egg reserve is going to fall over time, and this is an inevitable thing that unfortunately no technology can slow. So my biggest piece of advice is to think about, if you are thinking about egg freezing, do it at a younger age if you can financially afford to.
Yeah, so is 35 to 40 too old to be freezing your eggs?
Absolutely not, no. Talking to the individual, we would of course do an egg reserve level, and that may help us also to predict the number of eggs we may get from each stimulated cycle, and it may in those older age groups take a few cycles to actually collect enough eggs to give that woman a reasonable chance of having a baby in the future.
How many eggs do you need to have?
So that's a very good question. So there are the graphs that have been created to help practitioners try and predict the number of eggs needed to be frozen in different age groups. Around the age of 36, we think it's probably somewhere between 15 and 20 eggs.
And how many times do you need to collect to get that number of eggs?
Well, that depends on the response of that particular individual to the medications. It may take 2 or 3 egg pickups.
And if you're in that older age bracket?
Again, it depends if you have a high egg reserve level or a low egg reserve level. So again, I'd have a discussion with the patient about whether or not they actually wanted to freeze eggs, or whether they may consider something like donor sperm and the creation of embryos and having a pregnancy straight away.
Is there anything you can do to improve the quality of eggs before freezing? Maybe some lifestyle changes or supplements you can recommend?
Well, anecdotally, there's not a lot of scientific information around things like supplements, but we encourage women to take folic acid for at least a few months before they decide to freeze their eggs. and perhaps having some general investigations around vitamin D levels. We think there may be some evidence, but not strong evidence, that having a healthy vitamin D level might be helpful. It is very important if you can, and it's difficult for the individual to sometimes do, but a lower BMI, so a healthy range BMI, is very important. That can impact egg quality as well as response to the cycle itself. So sometimes women with a higher BMI may need larger doses of drugs to respond and produce enough follicles. And we do know that from good studies that the egg quality is also reduced if your BMI is much higher, so in the overweight and living with obesity ranges. So at Genea, we try best to use evidence-based medicine, which is giving people information and arming them with interventions or supplements that actually have been shown to be helpful.
Again, thanks so much for chatting with us today, Dr. Jyoti. In our next episodes, we'll be turning our attention to the numerous medical conditions that can interfere with getting pregnant. If you'd like to talk to someone about your fertility, you're welcome to contact Dr. Jyoti Ruba's rooms, or for a free conversation, contact Genea's Fertility Advisor team on 1300 361 795. If you need a referral to see Dr. Jyoti or one of Genea's other fertility specialists, our fertility advisors can book and organise a bulk billed telehealth GP appointment.